We also provide services for adolescents aged 12 through 18. This is on the inpatient side. So again, it's that highest level of care. It's that really intensive inpatient treatment where individuals meet with doctors or psychiatric mental health nurse practitioners, as well as psychiatric therapists, as well as nurses, of course, around the clock to help support their needs during that really critical time.
For a caregiver or for a parent to get their child to come to Riverside, the biggest thing is to sit down and to talk to them. To talk to them about the emotions that they're experiencing. If they feel like they want to hurt themselves or want to hurt somebody else, if you notice that they're journaling about things that seem to be darker, or if they're drawing kind of dark pictures, talk to them about that. Tell them, hey, maybe we need to go to the hospital to talk to a psychiatrist there or a therapist there, and maybe even start medication to get the help that you need so we can get these emotions and kind of things that you're feeling to calm down some.
Adolescence is extremely challenging, getting them to open up and feel that they aren't being judged. I actually think that sometimes it's even more challenging than with adults, to get them to trust, to get them to feel like they can open up about some very intense experiences, not just about anxiety and depression as a whole, but trauma.
See, a lot of the kids that we see on the unit, kind of with that lack of resilience, is something that you see in parents. So if there's a trauma that happens, it's not as much resilience there. The child picks up on that and they learn how to deal with that situation just like the parents dealt with it, or just like or like an older sibling dealt with it, or a guardian dealt with it. So if you can teach resilience early and kind of show that child what they need to do to deal in those situations, then down the road they'll generally do better. On our unit, we teach a lot of the coping mechanisms to kids. There's a list of 101, there are actually more than that, but we try to teach those kids how to deal with an emotional situation and try to react generally in a way that it's something that they won't regret kind of down the road. So of course there are going to be emotional situations for everybody. Do you want to react impulsively or emotionally in that situation, or do you want to react by kind of sitting back, thinking about it first, kind of taking in what's going on around you and then responding in that way? A lot of times if you use what's called wise mind as opposed to emotional mind, if you respond and it's okay to respond both ways, but if you respond in a wise mind kind of a situation, or in a wise mind reaction, then you generally will have a better outcome than you would if you respond emotionally to a situation. It's important to look at things from multiple aspects. So medications may help some of the symptoms. You're gonna need something beyond medication sometimes. And sometimes medication's not the answer. Sometimes it's just therapy. Sometimes it's for people who are interested in exercising. Sometimes it's yoga, like we're saying, recreational therapy. I have kids all the time who tell me on the unit, to be able to go home, I have to be happy. No, you don't have to be happy. Not everybody's happy 24/7. It's okay to feel whatever emotions you're feeling. If you're feeling sad, it's okay to feel sad. If you're feeling happy, it's okay to feel happy. If you're mad, you're angry, you're upset, it's okay to feel that way. If we weren't supposed to have these emotions, we wouldn't be made to have them. So we try to get the children to realize, or those kids to realize, that it's okay to experience those emotions. But when you are feeling those emotions, you respond appropriately and you talk to somebody about it, especially if it's something where you have a thought where you want to hurt yourself or you want to hurt somebody else.